All right, guys, welcome back for episode number 2 of the V Talk. I don't know if you heard the first episode, Sarah, but I decided to call it the V Talk because, everybody talks about men and penises and whatever, and we don't talk about the vagina enough, and we need to talk about the vagina, talk about women. And so I'm very excited to have you here with us. Kenneth, hello. Joseph, thank you so much for joining our new membership. We do have new memberships, so you can click the link and join our membership to support the show. We would absolutely appreciate that. So for our second show, Dr. Sara Black, thank you so much for being here with me. I would love for you to take a quick 90 seconds to tell us who you are, what do you do, as quick as you can.
Okay, sounds good. Yeah. And I want to talk about Christina's chat, but just super excited to be part of the V Talk too. So yes, I'm Sarah, and I am the owner of Zia Physiotherapy. It's an in-home and virtual PT practice in Northern Virginia, so a bit away from you. But yeah, I've been a pelvic and orthopedic specialist for about 8 years now, and just am all about pelvic wellness and really helping active women and men feel super centered, confident, capable as they kind of navigate life and all of the stages of life. So that's me.
I love it. I love it. Yeah. So the first question I would love to ask you is, when did you hear about pelvic floor health for the very first time?
Really in PT school. So I started as a personal trainer too before PT school, and kind of transitioned and went that route. But in PT school, I had a really great mentor who was just all about women's health. And I knew right away, as soon as she started teaching about it, that it's exactly what I wanted to do. And it's the core. It's at the root of everything, and everything is connected to the pelvic floor and the deep core. So I'm really a big believer that, like, our chronic hamstring strains and labral tears and low back pain, like, it's all connected, and the pelvic floor really needs to be at the root of addressing those things too. So
yeah, and that's
PT school.
Yeah, that's so interesting to me because, we don't talk about it. I actually started to learn about pelvic floor health, I would say probably within the last year. And I obviously have gone through puberty. I have gone through my periods. I have gone through getting pregnant, carrying a child, giving birth, postpartum. I was a dancer growing up. I mean, I've experienced so many different stages as being a woman, and pelvic floor was never part of the conversation. And it goes back to, the bigger conversation is, are women actually learning about their health and about their bodies in ways that are going to help us, versus us spending so much time like hating our bodies and stressing about our bodies. And it's not just the physical part, but it's the actual health of the body from the inside out that can really be beneficial to us. So it was very surprising to me now, because now I hear it all the time. And I wonder why that's not part of our conversations when we're younger.
Yeah. So, like, her whole conversation, like, that really just makes my blood boil, right? It's just so frustrating so early on in puberty, and just not raising active, body aware kiddos. It does start with that. And it can be more of a proactive, like, pelvic health in general can be more proactive than reactive. And so much is centered around postpartum and even being pregnant, but there's so much more to it. And really just the high prevalence in the athletic world too. So
well, when you say pelvic floor health, give us a little bit of insight into exactly what that looks like, things that we should maybe be looking for, signs or stuff like that, or when should we start reaching out for pelvic floor support?
Yeah. Loaded question, but we'll break it down for sure.
Yes.
Yeah. I think the most common is leakage. So it's urinary leakage, urgency, frequency, kind of having that sense that your bladder, like you need to go, heaviness, pressure in the vaginal area, pain with sex, arousal issues. Um, those are kind of the main ones. GI issues, constipation, would be considered pelvic health issues, and so that can be men and women. Um, More for the males, it's post prostatectomy. I mean, that's such a common surgery. 1 in 9 men have that. So there's that side of things, hernias. It's a whole bunch. It's like it's so much, right?
Mhm.
So that's kind of what pelvic health is comprised of. But the pelvic floor itself, there's the pelvic floor muscles for sure. There's ligaments, there's tendons, there's connective tissue, there's nerves, blood vessels, everything running through the pelvic floor. And the analogy I like to use is pelvic floor being like a trampoline.
Mm.
So it's rebounding pressure, it's springy and elastic, it's having to take on this load kind of constantly. It's never resting, so it's just totally different than some of our other muscles like our biceps and our hamstrings, and definitely needs to be treated differently too. Because there's like this is where I can really nerd out with the anatomy too, but it's
Absolutely.
super yeah, it's important to know that it's not like a bicep. It doesn't have bony attachments. Our pelvic floor is attached to our organs,
Mhm.
right? And kind of wrapping around, and so everything's kind of interconnected. So that's just what I love about it. That's what makes it a little bit more unique and a little bit more challenging to treat these kinds of issues. Back to what I mentioned too, it's never fully resting. You
Yeah.
can't you can't tell somebody just to rest their pelvic floor when they have issues. So
Mm. Yeah,
did
and
I
that
answer everything? What else do we have?
yeah, I mean, listen,
I
this
think I
this
got it.
is the conversation, and
Yeah.
I love learning about new things, especially when it comes to women's health. But again, it just causes that frustration that we just don't know. Like women
Yeah.
just don't know. I mean, and in this case, pelvic floor also is for men too, but like
Yeah.
we just don't know much about our body. It's kind of like it just is what it is. You started with talking
Hmm.
about, the leakage, incontinence, and all that type of stuff. After having a baby, we're just told that, well, probably for the rest of your life when you're jump roping, you're just gonna pee, and I remember, the first time I did, double unders in my CrossFit class after having my son, and I, like, could only do a couple at a time, our first
Yeah.
open workout, I had to wear black leggings because I
Yeah.
knew that I was going to pee, and I did, and it's the embarrassment of, "Oh my god, I'm peeing my pants," but also we're just told that it's just natural and it's just
Hmm.
going to happen for the rest of your life. I always joke that I have a baby bladder,
Yeah.
and I can't hold my pee that long. I just always had to go, and then having my son really took it to the next level, and there were
Hmm.
times that I'm, like, begging my wife to pull over because I cannot hold it, and I've barely had any water for the rest of the day or in the
Yeah.
morning, you know what I mean? And so
Yeah.
when you do hear this idea that, "Oh, it's just natural. There's really nothing
Hmm.
you can do about it. It's just something you're gonna have to live with." What's your initial response, and how do you, or why do you think it just kind of started to be
Yeah.
that was the answer?
Yeah. But that stems back to like, what are we not addressing before women have children?
Mhm,
Did you have your baby bladder before kiddo and kiddo made it worse?
mhm,
Which is more like I've been in treating thousands of women now. That's more frequent, more common than not. There's some underlying issues, either from just having parents that tell you, okay, we're getting in the car, you need to go just in case, like before this long trip.
mhm,
Um, athletics, your sports that you do. It's like all of that stuff. But then women are having children and learning and hearing more on social media about pelvic health, going to their OB, and their OB saying, oh, that's just a thing because it's on social media. Like, you don't need pelvic floor PT. So these women are asking for pelvic floor PT, and they're being told by their doctor, who they trust, and have relied on to have a baby, and go through that whole process, that okay, they don't need it.
Yeah.
And I mean, that kind of goes, yes, we can have all of these symptoms, kind of goes back to that, but I'm of the mindset where even if you aren't experiencing symptoms, if you're not having to wear the black leggings and you can't do your double unders because of leakage, like, even if you're not symptomatic, you need to have pelvic health rehab postpartum,
Yeah.
because so much has changed. Like, the posture, the postural changes during pregnancy, the muscles that atrophy because you have a growing chest, and then increased curving in your spine, all of
Your hips
that
change.
changes.
Like, your
Your
hips change. I
pelvis,
feel like
yeah,
my entire hips have just widened just a little bit and, like,
yep,
have never gone back. But, like, the
yep,
entire inside, literally skeletal, muscular nerves, all that has
yeah,
stretched, and it
yeah,
doesn't always go back.
right,
And
right.
so why don't again, the question
So
is
yeah,
why do we not know this? And it's not just postpartum, but again, when it comes
hmm,
to postpartum, it very much there's no plan. There's no postpartum plan. There's
yeah,
now women are starting to learn about pelvic floor health like you're talking about, and learning ways to navigate with their postpartum and that kind of stuff.
hmm,
But for a while there wasn't. And, like, our son is 8 years old, but I'm
hmm,
learning so much more now post-pregnancy, postpartum, with him
hmm,
being at 8, that I wish I just had some sort of information about when I was preparing pregnancy and preparing labor and then postpartum, but that's not included in the information and in the books that they're like,
yeah,
"Here, read these because it's gonna
yeah,
prepare you," but it doesn't actually prepare you for what physically is going on. It's kind of like everything that's outside of you. And
yeah.
so what makes you think that that is missing? Like why are we missing that?
I I think in the pelvic health realm, there's so many different kinds of providers. So
Mm,
that it kind of starts there. So there's gynecologists, there's OB-GYNs, your urogynecologist, there's GI specialists there, and so we have, that's the first issue. It's like, then it's you're just kind of chasing these issues, having to go from specialist to specialist, getting really frustrated with that. So I feel like it kind of starts there.
mhm.
Um, but you just have nobody in your corner. Like, nobody's
Yeah.
advocating for you. You kind of have to go about that yourself these days. So that's a
Yeah.
tough one. Yeah.
Yeah, and I just I'm not understanding, I'm obviously not in the medical field, but it just feels like as a patient, everybody's against what the other person is trying to bring to the table. And into the conversation, where if you take a more holistic approach, then you're complete anti-medicine. And it's like, that's not what I'm saying. What I'm saying is, can I have information for all? Can we come together
Yeah.
as a team? And
Hmm.
so when you're talking about all these specialists, and it's amazing to me that somebody that's underneath the OGBYN umbrella, there's so many different people, but yet they're still underneath the umbrella and they still won't work together. They
Yeah.
still will say to you, well, if you ask a question this way, well, it's for that person. But
Hmm.
then you ask the question a little bit differently and then they can help you. But it's kind of the same question.
Hmm.
And yet nobody's willing to listen and nobody's willing to support each other to really
Yeah.
create a team around women and their health and their physical health.
Right. And so, yes, I mean, we could talk about the postpartum world all day long. That is where things tend to show up, but PCOS, like in the first talk, um, endometriosis, which
What is that? Can you explain that to us?
endometriosis is,
Mhm.
so the way I describe it, it's like the non-cancerous cancer. It's pretty awful and can be really debilitating. It's where so you have very specific cells in your uterus that start to overgrow and then can extend to your GI system, your bladder, your spine, right? And so I call it the non-cancerous cancer for that
Mhm.
reason. The worst, most awful part is your ultrasounds, your CT scans, your imaging doesn't pick it up. So it's just these women with very debilitating, generally around their menstrual cycle, debilitating pain
Mhm.
that takes 7 to 12 years on average to diagnose. And
Wow.
and by that point, uh, I've just seen it this week, right? A woman in her mid to late 40s is now having to have bowel resection surgery and repair to recover all of this tissue that was damaged. So it's yes, postpartum is the whole postpartum world super important, but there's so much that we are going through as women: endometriosis, tummy, like any abdominal surgery, tummy tucks, hernias,
Mhm.
a whole bunch, whole
Yeah.
bunch.
Yeah.
So
Megan, what's up, my girl? After listening for the last few minutes, my back and hip pain, the doctors can't figure out is because of my pelvic floor. So Megan and I kind of experience very similar symptoms. So the way my son was when he was inside my body is he put a lot of pressure on my right hip. And
yeah,
so I was very, very tight. I felt a lot of my labor pain right in my right hip. He's 8. I
yeah,
still experience a lot of right hip tightness, pain, irritation that literally goes to my back as well. And I have
yeah,
not been able to get rid of either one. And it's very frustrating because you try all of these things. I'm in the fitness
yeah,
world and I come from a dance background. And so I'm like, mobility is important. I haven't danced in a long time. So I just associated it with I'm just not as flexible as I was before. I'm not as strong as I was before because
yeah,
I'm not moving the same way. And you go and you talk to everybody, you talk to these doctors, and they're like, well, just stop lifting. Well, just stop working out. Don't do this. Stop doing this.
mm-hmm,
You
mm-hmm,
know, and for me, I know that that's not one, what I want to do, and two, what I think I need to do because I
right,
know long term strength training is the best thing for us.
yeah,
CrossFit is the best thing for us, staying active, staying mobile. But I do experience times when my hip is so bad and my back is so bad that I cannot stand up straight, that
yep,
I can't squat correctly. I can't, deadlift and even lift things up off the ground. Sometimes I can't carry my kid. And so
mm-hmm,
starting to kind of listen to you and starting and, looking at your Instagram and kind of starting to hear about this,
mm-hmm,
you're saying it's possible that we could fix this, that we could get rid
yep,
of this pain that we're feeling.
yeah, yep. And to Megan's point too, I mean, it's just all connected, like we talked about before, but you you have these imbalances that unless you correct them postpartum, immediately postpartum or soon after, they'll stay with you. That doesn't go
Mhm.
away. I've seen women in their 60s and 70s with um, I like to think that I can connect it back to what they were doing, immediately postpartum and whatnot. It stays with you because of the pelvis needing to move differently while you're pregnant, very open, right? He's
Mhm.
hanging out on right side. So right side is maybe a little bit more, right side of the pelvis is a little bit more open than the left. And then we
Mhm.
go to deliver, vaginal or cesarean.
Vaginal.
Yep. And
Mhm.
so maybe we're stuck. We're just, so, maybe we're just still stuck in that asymmetry.
Yeah.
one side of your pelvis is doing something totally different than your left. And that's where working with a pelvic health physical therapist to decide, okay, it's not just strengthening your abs. Which abs do need strengthening? Is it your internal obliques? Is it your external obliques? Is this pelvis low back issue impacting how your ribs are aligned? Like it's all very nuanced, right? And just
Yeah.
takes a little bit of time to kind of tease out, but it's a really common issue. And so to Megan's point with the low back, with you, this what you've been dealing with, I mean, how many people in this world are dealing with low back pain anyway? But there's a
Everybody.
95%, yeah,
Yeah. Everybody
it's
that I talked to.
yeah,
Yep.
70-80% have at least one bout of low back pain in their lives, but it's 95% correlated to pelvic floor dysfunction. It
Yeah,
doesn't
'cause
mean,
normally
yeah,
they'll tell you just go get an MRI and it's gotta
yep,
be a herniated disc, it has to be something, and I hear so many people
yeah,
that go through these experiences of trying to fix these back pains
yeah,
and,
yeah,
their doctors, the first thing they wanna do is either give, what is it, like a cortisone shot. I know someone that's taken
mhm,
an epidural shot for in his
yeah,
back to try to help ease this pain, and then
yeah,
usually after that, the symptoms are 10 times worse because you don't need to be putting all this stuff into your body. We need to
mhm,
be strengthening our body
yeah.
from the literally from the inside out.
Yeah. And it's those, those injections, PRP, cortisone, epidurals, it's what those specialists and practitioners know. So they're going to offer what they know. They aren't musculoskeletal specialists.
Mm,
And so that's not going to be their first recommendation, right? They're just going to do what they know, and they'll tell you to avoid, unfortunately, generally tell you to avoid the activities that you love doing, which just, it's, I don't believe in that. I generally don't practice that unless it's something extremely severe.
mhm.
But specific to the postpartum world, we really need to have graded, progressive, personalized care for people, in getting back to return to sport. It's not, so that's like that 6 week follow up recommendation too. It's 6 weeks. Rarely are the physicians checking the pelvic floor tissue quality.
I don't
Six
think
week
I
green light, go. Yeah,
Yeah, I don't even if I mean, that was so long ago, but I don't even think that there was one. It kind of was like a touch on the belly a little bit. How are you
yeah,
feeling? Is breastfeeding going okay? And that's kind of baby's good.
yeah.
They weighed the baby, and that's kind of the gist, and then you don't hear from them anymore, you don't see them anymore.
Yep. Again, it's what they know. They're checking off for red flags. That's fine, but that's where we need to have a conversation about, hey, let's go see a pelvic health physical therapist. So, I mean, it's a
Mhm.
lot of what I do in this area is just trying to reach out to as many perinatal providers as I can. Like, let's get these women in,
Are they,
and seen.
do they receive you well? Do
It
they
depends.
close the door in your face? Do they say, "Get out of
It
my
just
office"?
depends. Yeah, yeah. It depends. They'll nod and listen to what you're saying sometimes and then never refer. But
Yeah,
some are great. Some
yeah.
are fantastic. So it just depends.
It
But
depends on the person, yes.
yeah,
Casey Higgins, the one that brought us together, grateful for you, told me not to lift more than 10 pounds, and both my kids are above 30 pounds as a 2-year-old and a 3-year-old.
hmm,
And yeah, and that's really what is the narrative. Like, do
yeah,
not lift. I mean, I was very sick in my pregnancy, so I was unable to really get off the couch. Like, I was very, very sick for, a very big part of my pregnancy. Um,
hmm,
but even when I started to feel good, it was this fear, because it took us and I don't know how much of our story that you've heard, but it took us 2 years to conceive our son.
okay,
I could not get pregnant. I had a lot of issues, had to go to a fertility specialist, IUI, Clomid, that kind of stuff. I just had a very hard time getting pregnant. And so then when we did get pregnant, Was it a difficult pregnancy? Yes, but I also was terrified of doing anything because it was
Yeah.
the fear of losing our child that we had
Yep.
tried so hard for. And so, but there wasn't even any support of like, okay, don't freak out. Like, you don't have to go and lift all this weight, but let's still keep you
Hmm.
strengthening the core and the pelvic floor and the hips and the back and the hamstrings and the glutes, everything that is literally holding and supporting this baby in you. Like, let's
Yeah.
do that. And
Yeah.
there's none of it. There's absolutely none of it.
Yeah. And it's unfortunate, but I mean, it's very, very much fear driven, and that is valid. That's
Mhm.
100% valid. But like Casey mentioned, why, yes, in the first 6 to 8 weeks, we want to be careful if your partner can take on some of that load so your pelvic floor can actually heal.
Mhm.
It doesn't mean avoid, and you're still going to have kiddos climbing up all over you if you have toddlers. So
Yep.
it's not realistic, first off. And I am as safely as I can trying to get moms to stay ahead of their kiddos' weight.
Mhm.
Safely, and feel again capable and confident and strong and able to do that. So
Yeah.
it's
Megan,
huge.
how
Yeah.
often should we go to a pelvic floor therapist? I've been once and they said come back in 6 months. Is that normal?
Oh, well, it definitely depends. Um, yeah, it just depends on what's going on. Do we have more acute issues going on, really high pain levels, daily issues, or is your body doing pretty well? I think if this is the same Megan, we just talked
Yep.
about low back pain.
Yep.
So I think there's maybe more to the picture, right? But I generally I'm seeing patients um, once a week to once every other week, but everybody varies. It's just so variable. That's a tough one. Um,
So,
but yeah.
no, go ahead. Go ahead. I didn't mean to cut you off.
Well, if someone's doing well and they're in kind of in, we're not in the like, okay, let's figure it out stage, and we're not in the fix the things, and we're kind of returning back to activity. If they're more so in the maintenance stage, it's yeah, you've had some dysfunction, let's check in once every 6 months, once a year. But that's when you feel like you've returned back to everything that you want to be able to do.
Mm.
And you're able to engage with your family and do the sports that you want to do, lift the weight that you want to lift, and there's no repercussions to that. Is when I have the let's meet once every 6 months to once a year. So
So, when someone comes to you and says, I'm not sure what's going on, but I would like to explore options. I've heard pelvic floor health is important and could be related to this. They knock on your door and they come into your office, and what does that process look like? What is like the first conversation? How does the exam go? And then how do you, I know you said like specifics for certain people, but kind of
yeah.
walk us through like the process of walking through the door and saying, "Hey, listen, I think something's going on and I heard pelvic floor should be something that we should be talking about."
Yeah, well, before we even meet, and Casey helps me with this, but before we even meet, there's a very extensive prior medical history kind of welcome packet. So
Mhm.
I'm kind of covering all of the bases in that welcome packet to determine where I'm going to go with my assessment. And so in that first session, it's just the start of the assessment. So that's a big part of the conversation too. This is not, I don't know your body yet. I don't know
Mhm.
you. I don't know the emotional side of it, the hormonal side, the physical side. I don't know anything yet. So we're going to start assessing things and trying to figure out what the root cause of your issue is in the first session. But it generally takes me about 2 to 3 sessions to really figure it all out and get things going. Um, and in that first session, it is head to toe assessment. Most of the ladies that are coming to me, even males, have seen multiple clinicians before, And so they're kind of at their wit's end, and it's been a chronic issue. So I can't miss any steps. We have to be pretty
Mhm.
tedious with it. So it's head to toe. What's going on? What might be contributing to what you think is a pelvic health issue? And then it's getting them into exercise, whether that's mobility, strength, um, tapping into the neuromuscular system, just getting certain muscles to wake up that have kind of been on vacation, and calming some other ones down. But that's really the start of everything. And then again, just building the confidence to be able to get back to the things that you've stopped or that you've really cut back on. And that could be a number of things. But um, yeah, that's really the start of the journey with me for sure.
Yeah, because it's also this idea of pelvic floor health kind of comes into this woo-woo, holistic kind of
Mhm.
conversation now and again, you kind of if you're on one team, that team says, "Well, you must be against this," and what we're realizing is that we do need both,
Yeah,
or at least give us the information for both. And
yeah,
then we can decide how we navigate through everything, this idea that, you know, not everything needs to be medical, not everything needs to be given a pill,
yeah.
and then also too, not everything has to be against medical intervention, that there
Yeah.
is a middle ground that we can all meet at if we're given the information. And it's
Mhm.
the more and more and more that I read and I talk to and in my own experience, like, it's just the frustration of, like, we just don't know what goes on with our bodies. We're just
Yeah.
told, like, it's just hormones, it's natural, it's gonna be like that, you have a child, that's just how the body is gonna be,
Mhm.
and it's like, yes, and there are some things that we can do and people that we can talk to put in place a plan that could support that, that could
Yeah.
give us some sort of guidance so we're not swimming in the dark. Like, there
Right.
has to be a light somewhere where there is relief. There is something to look forward to. There is something to, like, aspire to and get to and believe that, like, I wanted to believe that my hip pain would just naturally go away. And
Yeah.
it's been 8 years, almost
Yeah.
9 years, and it has not gone away. And I just kind of was like, "Well, this is just gonna be what my life is gonna be." But I don't want my life to be like that. I want to feel better. I
Mhm.
want to be able to do all those things that I could do before
Yeah.
without the hip pain, without the back pain, to the point again where sometimes I can't get out of bed and I get frustrated because I can't go move my body. And I want to
Yeah.
work out and I love to work out and I love to CrossFit. And I've just found Pilates and that's been very helpful with my core, with my hips, with my back. And I
Mhm.
want to do all of those things so that I can be there for my kid and I can run around
Yeah.
with him and be active and stuff like that. But if we're not given this information,
Yeah.
we're really just kind of out there on our own. And you hear so many stories that are like, God, if I just knew one thing
Mhm.
before I got pregnant, while I was pregnant, after I got pregnant, or even if you don't take that journey, even if you don't carry a child, just
Yeah.
going what your body is gonna go through and how much you do need that kind of support.
Right. Right.
It's so frustrating just to think like, God, we just don't know shit. We just are not given that information.
Yeah. Yeah. And so maybe like go and so going through this kind of head to toe assessment, so
Mhm.
hopefully it kind of resonates with anybody that's watching, right? It doesn't have to show up as pelvic health symptoms.
Mm.
So tightness in your jaw,
Yep.
TMJ issues, the fact that we have estrogen receptors in our jaw, like how can that not be connected to our pelvic floor? So starting there, like, are we holding tension up here? Then you're most likely holding tension at the bottom of your canister, right?
Mhm.
Are you a gripper, a rib gripper, right? Do you generally see cinching at the rib cage and bloating in your lower abdomen?
Yes.
That could be dietary, right? It could
Mhm.
be dietary, but it's it's generally the case in my runners and CrossFitters. Holding like an imbalance, overuse of your external obliques, underuse of your internal obliques,
Yeah.
and the impact that it has on your actual core canister in your midsection, rib cage mobility, your breathing pattern, what your ability, is there, abdominal separation. Do you always see this big bread loaf, rectus activation when you're exerting yourself and PRing and going through your deadlifts and squats and toes to bar, like anything? Are your six-pack muscles running the show, or are we getting some outside ab assistance, right?
Mm.
So those are the things that I'm looking for. Your hip mobility, is one hip doing something totally different than the other hip? Is one totally locked up and one's really loosey goosey? All of that, like that's what I'm looking at, and I'm watching you move and kind of doing the things, right? To see what's going on and what we really need to focus on. That has nothing to do with the pelvic floor. Sometimes it's several sessions before I even look at the pelvic floor, and we're addressing, like peeling the layers of the onion, right? We're addressing things from the outside, and then shocker, the pelvic floor is offloaded in a good way, and we have no more leakage, right? So
Mhm.
I don't always go straight to the pelvic floor. Actually, rarely am I doing that.
So it's
So
really a top to bottom assessment to really go through everything and
yeah, yeah,
not miss something. You're
yeah,
checking everything like you said and making sure that it is, because most people come to you frustrated
yeah, yeah,
and with no hope that that anything is going to work. And so taking
yeah,
those steps to really go through the entire body, to check that. Um,
yeah,
Seema,
yeah,
what's up,
yeah.
girl? Can you have pelvic floor problems after a DNC at 4 months?
Sure, yeah. Um, that's in line with, okay, abdominal surgeries, laparoscopic surgeries that we and just different procedures, right? And I'm throwing the DNC in there as well, but things that we feel are seemingly not that intense, but they're totally shifting things around in your insides and your organs. So yeah, scar tissue, um, whether then your internal organs are able to slide and glide on each other, how connected that is to your psoas, your hip flexor, huge hip flexor muscle in the middle of your stomach, for instance. That's all going to play a huge role in how the pelvic floor functions, and definitely like cesarean, right? We are cutting through all of your abdominal muscle to get to the uterus. And so yeah, 100%, like scar tissue and lack of mobility in that scar tissue, lingering numbness, that's at any scar, but more common in cesarean scars. Like that's not okay. That's not how it's supposed to be. Puckering at the scar. These are things that I think women would pick up on, that they might not think is connected to their pelvic floor. Even like your feet, your foot, your shoe size sometimes changes after pregnancy and delivery, or
I
your
just
bra.
heard that.
Yeah,
I've
yeah,
never heard feet changing. I've
yeah,
obviously heard like your chest and your hips and like that changes, but I heard
yeah,
that today. So explain that. So your feet can change, your
yeah.
can grow.
Yeah, because but and well, also bra size, the circumference of your ribs, not the
I'll say
cup
the
size,
rib
because
cage.
that's,
Yep, yep.
yeah, I mean that is a telltale sign that you've still got some rib flare that we need to work on. We're really nerding out, but
I
the
love it.
feet,
But I don't mean to cut you off, but
yeah,
I people might call it nerding out, but this is just information.
it
This
is,
is just,
yeah,
this is just information that we don't talk about. we don't
Yeah.
take the time to talk about, we don't take the like, nobody takes the time to explain this stuff to us because
Yeah.
if anybody told me that my ribs could potentially have gotten wider and that
Yeah.
there's a way that I could that like it's a flare that with some work I could maybe tighten that or fix that or
Yeah.
whatever to help support
Yeah.
the rest of my core to take away my back pain. Like, wait, what? That for
It's
me is like,
yes.
wait, there's options and there's stuff that like can support you other ways that's not just
Yeah.
one way. Because we all want
Yeah.
the six pack. We want the six pack in the front. And that's
Yep.
whenever anybody says, I want a stronger core, they always point here. And I'm like,
Hmm.
but your obliques are part of your core and your
Yeah.
back is part of your core and your the bottom of your lats and your glutes and your ham. Like this is all part of the core of your body to
Yeah.
protect and strengthen and hold you up and support you in so many different ways. But now hearing, wait, there's an inner layer of a core
Hmm.
of the
Hmm.
oblique. I know the oblique. You're telling me that there's layers within the oblique that
Yep.
we might not even be strengthening. Like
Yeah.
it's mind blowing, you know?
Yes. And guess what? It all did change. Like there's no woman that went through pregnancy who didn't have their ribs flare. That is
Mhm.
a change. We have to make room for baby. The pelvis is supposed to open up. The ribs are supposed to flare. It's just immediately postpartum takes you're only 60 to 70% healed, return to normal abdominal length at 8 months postpartum. So let's think about all of these women that are getting back into their activities 6 weeks after. Like nothing's healed. You can't rush that healing. But generally, yes. I mean, I'm working with a woman now that's 5 years postpartum and still has a pretty significant rib flare and low back pain and neck pain and bloating that she can't get rid of. I mean,
Girl, you are preaching. I
yeah,
am struggling with this bloating that I have been experiencing. I've tried dietitians,
yeah,
I've tried supplements, I've tried this, I've tried that. And it's just like the thing that
yeah,
I just cannot get rid of no matter what I do, you know?
yes, yeah. And so it's taking a look at the ribs, it's taking a look at your hip flexors, knowing that your hip flexors deep in your stomach can literally cause your lower abdomen to protrude when it's tight. And who doesn't have tight hip flexors because we're all, sitting a lot or lifting
Yep.
heavy things, right?
Yep.
So that's stuff that we don't know. But back to the feet.
Yeah. Yes. Oh my God. Yes.
So
Feet, tell me.
so they will splay during, you just have this extra load that you're carrying around for 9 months, so that your arches tend to flatten a little bit. A lot of it sometimes, if you already kind of started with flattened arches, then it becomes more of a problem for you. We have collapsed arches, and if you don't work on your foot intrinsics to actually lift the arch of your foot and regain that natural lift, then it will stay with you, and we end up with Achilles tendonitis, plantar fasciitis,
Mm.
neuromas, like all of these foot issues that you would never really think are connected to you being pregnant and gaining a good bit of weight or what have you. So
Yeah.
yeah,
Plantar
yeah, that's
fasciitis.
it. Yeah,
That's a tough one.
yeah,
Seems to be the new thing that everybody is experiencing. Every person that I talk to is experiencing some sort of foot pain and irritation and whatever. And you don't think that it's connected to something else and
yeah,
that it needs to be supported by something
yeah.
else. Liv, I see you. Don't worry, I didn't forget. Olivia, do you implement ART, active release techniques, with your patients? If you do, can you start from the beginning and explain what ART is?
I'm actually not an ART provider.
Okay.
So I don't, while I do similar things, we're not calling it ART, and I'm not certified in that. But The concept behind it is impressive and it's helpful. It's just another way to kind of unlock muscles or to get muscles to do what you intend them to do. Muscles are not smart. We need to regain control of our muscles. Like you can will them to do what you want them to do.
Mhm.
But they will um, they will run the show. Like your body, if you need to lift a 50-pound child, but you're not strong enough to do that, your body's going to find a way to do it.
Oh, yeah.
So
Mhm.
there's a whole bunch of compensations, and so that's where strategies, techniques like that can really come in handy. But
Okay.
yeah,
So it's like a technique kind of thing.
you have to be certified. It's
Okay.
like dry needling. I do use dry needling quite
Oh,
a bit in my
okay.
practice. It's like Groston, if you've ever had the metal scraping of
Oh,
your
the
fascia.
scraping.
Oh yeah,
Okay.
you
Okay.
you have to be certified in those kinds of
Is it like the
techniques
dry
to.
brushing too?
Dry brushing is yeah, is a
Okay.
different.
It's all those kind of things.
All the fascial things, cupping, all of that kind of stuff.
Oh, I
But
love
yeah,
cupping. I've gotten cupping done a couple times. I love that.
it's
It's
lovely.
painful when it happens, but it's
Yeah,
very, it makes you feel good
yeah,
after.
yeah.
Does an epidural play a role at all? Hi, baby. This is my wife. This is Garrett. She's
Hi, wifey.
in here supporting, and you will meet her one day.
Good,
Um,
good, good.
so, um, we've been having this conversation or whatever. So I had an epidural
Yeah,
when I was in labor. I was about 6 centimeters, I think I was, and I got an epidural. So after I got the epidural, I could still feel some pressure, but I couldn't feel the pain. So they put a catheter in and all that type of stuff, and I could feel the discomfort from the catheter, but didn't feel any of the pain. But
hmm,
my epidural wore off. So
okay,
I literally felt delivery as if I had not had it. And
yeah,
some things that we're hearing is that epidurals now could cause issues later. So I don't know if this is
yeah.
like not really your expertise or whatever, but could an epidural have played a role in or play a role in my hip, my back pain, my pelvic floor issues? Could that have played a role in that?
A little bit loaded. Like, do I think I think it was more so for your hip sake. I think it's more how kiddo was hanging out in the womb.
Mhm.
And maybe we haven't brought things back to neutral yet for
Okay.
you.
Mhm.
But the epidural is in a number of ways can have a huge impact. I do have women that are experiencing pain months later after their epidural, pain that travels kind of up and down the spine. So you're impacting the fascia that runs along the spine, which takes, again, we just talked about it, just takes a long time to heal. The muscles, the ligaments, the tendons that you're impacting when you have that epidural, um, the disc space, like the just that whole spinal casing, whatever you want to call it. That's
Mhm.
all impacted. Now, with an epidural, then yours were off, but you're generally then with a vaginal delivery not feeling what the heck is going on with your pelvic floor. And so that can be problematic. Not being able to feel relaxation in the pelvic floor, which is just super important to deliver.
Mhm.
Um, Not being able to feel it. You can't. You have no sensation there. So that's where immediately during the active labor stage, having mirrors and really focusing on getting good rib cage expansion to help kiddo come out. Your different laboring positions, side lying, all fours, squatting
Nope.
position.
Nope. I was on my back with
You
my legs up. That's
Yeah,
literally
and
where I
and with
was the
an
whole time.
yeah, and with an epidural, it gets really tricky because they don't generally, you're definitely not getting in all fours and squatting. Side lying is even a push for them when you have an epidural. So um, then we're not getting that sacrum out of the way for kiddo to descend and come on out. So
Yep.
that's the problem with being on your back.
The whole time. Yeah.
It's not the most efficient way to actively push.
Well, and I
But
also had a very difficult time pushing at first. So I didn't actually learn the correct way to push. I just
yeah.
was told he's here and push when you feel a contraction. And I was like, I'm in
Hmm.
so much pain right now that I can't tell the difference between a contraction,
Yeah.
when to push, when not to push. Like I was in so much pain because my epidural wore off and he was right, like his head was there. You know what I
Yeah.
mean? And I don't actually think that I got dilated all the way to the full 10 because my son almost tore me right straight through. So
Yeah.
whatever that is between the vagina and the anus, whatever that's called.
Your perineum. Yeah.
Yeah. So he almost tore me straight through. And so
Yeah.
they didn't cut me, which is called what's that called when they cut you first?
Yeah. Episiotomy.
Yep. So I didn't have that. And
Hmm.
I literally just felt like the doctor was like trying to extend
Yeah.
and open me up a little bit more so that the baby could come out because
Yeah.
he I had to get stitched in 3 different places
Hmm.
and I was so swollen and I was in so much pain that I was like,
Yeah.
"Stop touching me." Like, and
Hmm.
he was trying to numb me and so that he
Hmm.
could stitch me up, and I felt all of it. So the I just was like, "Please stop." Like, they put the
Yeah.
baby on my chest, and then they had to take the baby off and give the baby to my wife because I couldn't sit still. Because I
Yeah.
literally was like, "Please stop touching me because I am in so much pain," but they couldn't because 'cause I'm bleeding.
Hmm.
They need to get the
Hmm.
placenta out, they need to stitch me up because 'cause I'll bleed to death, which I get that, but I was in so much pain, and I don't think I was actually fully dilated because I was
Hmm.
on my back the whole time. The minute they gave me the epidural, and my wife brings up too, is that my water didn't break naturally. They broke my water for me.
Yeah.
So once they did that,
Yeah.
I literally was on my back, just, dealing with the pain until I was like, I need an epidural because this
Hmm.
is so painful, but
Hmm.
never got up, never tried to change positions, never was on about the bouncy ball, nothing. I literally was on my back the whole time and I
Yeah.
just don't
Yeah.
think that I was fully dilated when I had
Yeah.
him.
It's and how traumatic. Like, yes, for your body, but then emotionally, how do we recover from those kinds of things? And that's a very common birth story that I hear. It's one of the things that I offer is a couple like a perinatal package. So a couple of sessions before to kind of prep you for labor and talk about, okay, what do we do in the different stages of labor, right? To help you when we get to the active labor stage. Generally, the uterus is what's going to push baby out. What we're getting into is like rushed labor and delivery, which it sounds like they broke your water, like they were kind of rushing this natural process. We didn't just let it happen, and that needs to happen sometimes for baby's sake, but we're just rushing the natural process, and your body might not quite be ready, and your pelvic floor muscles might not be ready. It sounds like your pelvic floor muscles were really working against you a little bit, um, and then add on top of that, not the best position. Plenty of women deliver on their back, and it's okay, but that's where we're getting into tearing because we're rushing that natural process.
Yeah.
Yeah. So it all plays a role. And then, yeah, then your pelvic floor is going to take a little bit longer to heal than the next person's.
Probably
And
8 years, 10 years. It sounds like I'm still experiencing that. And it was when they told me that, they're like, come back at 3, 3 in the morning, because we went there because I was starting to feel labor and I was nervous and I was like, I'm not going to be okay until I have a doctor examine me. Again, this is my first
mhm,
child. I've never experienced this before. I'm just every step of the way, I'm just terrified that something's going to
mhm,
happen. God forbid, I'm going to lose this baby. You
Right.
know, I was already going through a lot of emotional stuff because I felt like my body was failing me because I couldn't get pregnant. So, I mean, like all of these emotions I was having. So we got
Yeah.
there and then the labor really kind of stopped. I had to wait for the doctor anyways because he was in another delivery and stuff like that. So my wife and I are up walking around and just having a good time. And, you know, I ended up dilating a full centimeter within an hour because I'm up and I'm moving and I'm
Yeah.
not in pain and, you know, that kind of stuff. And so then when they told me that you're starting to get into labor, come back at like 3 o'clock in the morning because that's when it's going to be. Again, it was
Yeah.
another thing that there was no explanation. It just terrified me. I'm like, I'm not going. What do you mean I'm going home? I'm not going home. There's no way that
Yeah.
I can go home because I need a doctor to be here to safely deliver my baby. You
Mhm.
know, because there really
Mhm.
wasn't any sort of conversation that was had of options of like, do you have to go through full delivery at home? No, you don't have to go through full delivery at home, but there's options for you to go and be home a little bit longer, and it's still
Yeah.
safe for you to be home a little bit longer for your body to naturally perform that. And there was no conversation about this
Yeah.
is natural. This is normal for your body to do that. And
Mhm.
and I really think that, you know, the hardest part for me through all of this, and I'm gonna try not to get emotional because this really sucks, um, is I didn't get to enjoy any part of labor, and part
Mhm.
of me doesn't even remember labor because I was in so much pain, and I just kind of felt like it was, "Let's go. Let's get this baby out," and there
Yeah.
really wasn't any support that was in there from the doctor and anybody that could be like, you're okay, like, it's okay." You know what I mean? Obviously, my
Mhm.
wife was there and she was supporting me and whatever, but, like, we waited so long to have a baby,
Yeah.
and I don't remember it. I told her, I think we were talking about it a couple years ago, and she's talking about it, and I always ask her, and she looks at me sometimes, and she's like, "It's almost like you were there too, but I wasn't." Like, I
Mhm.
was, but I wasn't, and I
Mhm.
really missed out on that. Like, I don't remember them putting him on my chest for the first time.
Yeah.
That's how much pain I was in. I don't
Yeah.
remember, like, I had pictures, and I kind of remember him breastfeeding, but I don't remember the very moment that they pulled him out and put him on my chest.
Yeah.
You know what I mean? And then
Mhm.
I don't remember them taking him from me, but I would remember moving from them, and I'm like, "Please just stop touching me." You
Yeah.
know? And, like, I remember those things, and it just sucks that there wasn't really much support from them or somebody that could have supported me and my wife in that emotional state. Well, the
Yeah.
doctors did what they did, you know what I mean? So, it's tough. It's tough. Alright,
Yeah.
guys.
Yeah. It's but you share a story with so many women having their labor and delivery not go the way that they wanted it to or what they expected, especially if you if you're one that's usually in control of everything and then this just wreaks havoc like and you're just totally out of control. It that emotional piece stays with you forever. And it takes a lot. I say forever, but it takes a long time. You have to talk through that and work through that. It's but this is what's happening. It's more of a reactive pelvic health in general is more of a reactive rehab, right? Instead of let's be proactive about it, let's do the best that we can for labor and delivery. Whatever's going to happen is going to happen, but let's at least like work on some of these strategies that you can take with you into labor and delivery so we don't end up in positions like that because it's awful. It's,
It it sucks. I hear so many other stories of women that you know, and again, I'm not saying that I would've wanted a baby at home. Like, I'm not saying that I would've wanted
no,
to
yeah,
experience that, but just hearing the bigger picture of more support, that
yep,
there is more support around pregnancy and postpartum and labor and all that type of stuff. Jake
yeah,
Chapman. Hello, Jake. That's not the one I wanted to pull up first. Hold on. My wife is weighing options for giving birth to our third in December. Horrific lumbar disc issues. First birth was tough with a spinal and forceps. Second flew out, 20-week scan tomorrow. Yep. Yep.
Yeah.
Can you explain
So scary.
why?
It's scary.
Yeah, 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 yeah. Do you have knowledge as to why um forceps are still used?
That is when I see forceps delivery, it needs to happen. Something's going on, kiddo's not coming out, and it's too late for a cesarean or what have you. So
Yeah.
very, very rare now for vacuum assist, but forceps, yeah, forceps are still
Mhm.
used, and then you're higher risk of prolapse with that, and certainly the tearing. So yeah, that's
But they
my
are still
question.
necessary, you're
Oh
saying,
yeah,
as like
yeah,
a as
yeah.
a last result kind of thing. Yeah.
Yeah, but my question is always, what could we have done to prepare your body a little bit better for labor and delivery? Maybe nothing, but maybe we could. Maybe you had some overactivity in your pelvic floor that, and stiffness in your hips and your low back that we could have addressed that. I don't want to say avoid, but maybe, right? That's
Right.
always the
Could
question. It's
have.
like,
Could
yeah,
have.
maybe,
Yep.
maybe.
Yep. Olivia, I didn't remember much, ton of blood loss, transfusion, crossed for 5 days after passed out. So many memories lost, makes me sad too, Colleen. Yeah.
Yeah,
Yep.
you're not alone. Yeah, I
Yeah.
mean, I hear it again, thousands of women, thousands of stories. It's really unfortunate. I love to get my ladies before they deliver,
Yeah.
and see them through every stage of life. That in a perfect world, if I could do that for every woman, from adolescence on, like that would just be so great because, yeah, I mean, it starts with what you were talking about with Christina, and we're not learning enough about our bodies. Nobody's really talking about this set of muscles that, is control of three of our vital human functions: to poop, pee, and procreate. Why are we not talking about this earlier? You know, it's it. It's not too late postpartum, but there's a lot more that needs to be addressed. So
Yeah. Yep. Clarica, it seems like a beautiful, brave as fuck experience. I've
yeah,
never met a mom who regretted it even after. No. No, 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 no. Definitely don't regret it. But definitely have been working through the process of guilt. And at some point, my wife and I have been back and forth, thinking about having another one. We did try for a full year to conceive a second one. Again, I struggled with pregnancy. I could not get pregnant. And they wanted to start to introduce a lot more invasive um, medicine, needles, kind of starting to take the IVF approach. But for my wife and I, it's just not something that we really feel comfortable for her. The idea of continuing to put more and more shit into my bodies is not something that feels good to us, to take that route. Um, but I've gone through those emotional feelings of I need to have a second baby to do it better the second time. Because I feel like, okay, hold on. Whew. I feel like
yeah,
I let my kid down. I feel like I robbed my kid of a lot of things. I think I feel like I robbed myself of a lot of things because we wanted this baby so badly and we got this beautiful baby but I missed out on a lot and I feel like I let him down and I deal with those emotions sometimes of like I want to do it better. So I need to have another kid to do it better, and so it's like fighting with those emotions too.
yeah.
Mm.
I am sure you have a lot of women watching this that are just in tears, like feeling the exact same way. I mean, it's just heavy. It's heavy stuff. Um,
But I have an amazing
there's no
wife
way
that
around it.
tells me that I didn't I didn't take him
You
from
didn't.
anything. Yeah.
No,
Yeah.
no.
Yeah, yeah,
Yeah,
yeah.
we should have started with that, but no. Yeah,
Yeah.
but that, I
Uh,
mean, the guilt, it'll stay. It'll stay with you.
y Why didn't our moms
Oh,
tell us? Was it because they didn't know?
yeah, yeah, 100%. I mean,
Yep.
um, That's what I believe. That for me at least was kind of in the stage where we're not meant to complain about our bodies and what's going on, and it was very hush hush. And then I was growing up in the 90s and learned how to insert a tampon myself. We didn't talk about sex. We didn't, and I was very sexually curious. Like, no, there was no conversation about any of this kind of stuff. So it's getting better. It's getting better.
Mhm.
It starts with everyone that has young kiddos now, and just not making it so taboo or shameful. This is a huge part of our body. So
Yeah. And it's important that we talk about it. It starts with us to be able to
yes,
talk about it and to learn more and to, yeah, change the narrative around talking about the vagina and talking about periods and hormones
yes,
and whatever, like, as it's something that's taboo. Like, we go through it in our lifetime. Like, we just
yeah.
do. And why why is it so taboo to talk about how big our asses are or how big our boobs are and whatever, but we can't talk about the inside of our body and what it's going through and how we can
Yeah.
support that, and, like, that for me is so hypocritical. You wanna talk about how big my ass is, but I can't talk about why I still have hip pain because my pelvic
Hmm.
floor or my pregnancy or postpartum or your period, or, like, you can't talk about that kinda shit, but we're doing
Yeah.
that now.
Yeah.
We're doing that
It's
now.
changing. This right here, like, this is the start of it. It's changing. I think it's um more on the female focused side of things. It's going to take a little bit of time for all of this to catch up. But
Yep,
you know,
starts
it
here.
starts with our healthcare providers. We just have to do better. We have to be okay with collaboration and helping these women get through every stage of life, because we're who they trust. And so that's, I just always feel like I need to advocate for my patients and make sure they're getting the care that they need. If it's not with me, then I am definitely referring them to where I think they need to go. Um, but education, it's okay. I'm going to teach you. It's not too late. It's never too late to learn more about your body and what's going on. So that's just a big part of my treatment is education. Okay, this is what your body's doing. It's not broken. It's not trying to work against you. It's doing the best that it can. It's causing pain along the way and dysfunction, but we can sort that out. So
Yeah, and I love that you talk about referring to other people. If it's something that you can't
yeah,
personally
yeah,
do, you
yeah,
refer it to somebody else, and we gotta stop being in competition with each other.
yeah,
If we're all working towards the same goal, we all have a place on the steps. If
yes,
the goal is at the top of the steps, we all have a place on the steps to get patients and women and men and all of us to feel the best that we can to get to the top. But it
yeah,
doesn't have to be this, and kind of like what you were saying before of, like, some people do receive you well and other people don't, and it doesn't. It
yeah,
feels like this, like, competition, and it's like, but wait, aren't we all trying to accomplish the same thing? Aren't we all
hmm,
trying to give more education and more health and wellness for women and for men and, for mothers post like postpartum labor, like, aren't we trying to make it as healthy and as
yeah,
good as possible? That means we all can be on the same team even if we play different positions.
yeah,
We're all on the same team.
yeah.
Jake, who do you think or who do you feel was telling you that you couldn't talk about it? Your moms? Um,
Mm,
I mean, Sarah, I was a lot like you. Like, I don't know if you didn't have the conversation with your mom or anybody to kind of talk to you or whatever, but, like,
yeah,
I never had the sex talk.
no,
I learned how to put a tampon in by myself. And this is,
yeah,
guys, this is back when and I don't know if the men in here would know the difference, but back when cardboard tampons were a thing. We
yeah.
didn't have the pearl
That's all we had.
tampons. We
Yeah,
didn't have the pearl tampons that we do
yeah,
now. Um,
No.
but I learned how to put my own tampon in.
Yeah.
I never had the conversation of what your period meant. I just learned that you bleed once a month, and then when you start to be sexually active, you need to be on birth control because it'll stop you from getting pregnant,
Yeah.
and that was that.
Never mind what that does to your body. But
Right, right.
I mean, I think too, like, why did I not feel it? I mean, I was ready to talk about it. I was asking questions. It's more like, into this day, I'll ask my mom, I'm like, well, when did you hit menopause? Right. And she won't talk about it. So it's questions, it's being curious, but not getting answers. Like, did you have painful periods? Ah, well, I don't know.
Yeah.
it's just in that sense. And then I don't know. When I was growing up, I didn't feel like I could talk to my friends about it. We definitely weren't talking about that
Right.
side of things. But yeah, man, I went through a whole box of tampons to try, because I got my period. I remember, like, the first day of seventh grade, and I was a swimmer. I grew up swimming. I had to go to swim practice in the afternoon, and I was
You had to
terrified. I was
figure it out.
bawling.
Yep.
I mean, at least my mom was outside of the door, but she didn't, we're not offering to help. It's just
Mhm.
like, you got to figure it
Mhm.
out. You got to go to practice. So yeah. So, with, we have a 17-year-old daughter, my stepdaughter, in the house now, and um, she'd probably kill me when we're talking about it, but, like, giving her, at the once we're reaching that age, right? It's like sending them to school with a little period pack, like, here's some pads, here's a tampon, here's some Advil, right? Like a little
Yep.
discreet period pack. So, like, this is coming someday, right? Let's just keep it in your backpack,
Right.
for when you need it. And then, um, teaching them how to insert a tampon, right? It's not the way that you think it is. You definitely got to angle back, right? It's
Yep.
just simple stuff, like, here's a mirror, right? And so it's definitely a lot different than I think it was. I wasn't handed a mirror. I wasn't taught,
Me
you know.
neither. Me neither. And I think I love the fact that you use the word curious, because I
Yeah.
think that the only way, at least I can remember, and I'm not sure if it's starting to change yet, but the only way that girls could be curious is sexually. They couldn't be
Yeah.
curious about their own bodies. They couldn't ask those questions about, "Hey, what does this mean? Hey, how do you
Yeah.
do that? Hey, why is this like that?" It was more
Well, yeah,
good.
but not even sexually curious. Like, even then it was like, "Oh, you're a slut." Or,
Yes.
that's not how women should be. It's okay for guys to be like that. But
Yep.
yeah, not even that.
But what I'm saying is that,
Yeah,
like, I also started my sexual curiosity very young,
yeah,
and I feel like it was partially because I wasn't allowed to be curious about my
yeah,
body, my
yeah,
own
yeah,
personal body, so the curiosity came from other people being curious in my body.
yeah,
So that's where and it was kind of, again, it was kind of one of those things where, like, I never talked about it. It just started to happen. And it was like,
yeah,
"Oh, this is what I'm supposed to do because, you know, guys won't like me." Because when
yeah.
I was younger, I dated men, and then I came out much later, and I've been with my wife. We're celebrating 13 years on
Yay! That's a
Friday, the
big
8th.
one.
Yeah, on Friday.
Nice.
Um, so there was no conversations about curiosity for myself, or having
Yeah.
people that I could ask about, their own bodies, of like, "Hey, listen, like, my boobs are getting kind of big. Why?
Hmm.
Like, what's happening? I have
Yeah.
my period. How do I figure this out?" Whatever. It was finding out curiosity about my body because other people were curious about my body, and started
Yeah.
to, you know what I mean? Like, experience it that way. And I feel like, and again, we don't know. We don't know how things would have played out, but I feel like if that was a little bit more accepted, where you could
Hmm.
start to be curious about yourself, that girls wouldn't feel like they needed to be, like, learn their curiosity from other people, if that makes sense.
Right. Yeah,
Yeah.
100%. And I think that's still kind of the way that it goes. Where I wish, and earlier on in life, I wish we would learn a little bit more about our bodies and be okay doing that. Like, take a mirror and check out your anatomy and know where things are. I mean, I have women in their 60s that don't know the parts of their body, and don't know anything about the clitoris. Like, we just and I don't, I mean, that's not talking about age related issues there. It's just, some of us totally dissociate from that part of our body.
Mm.
um and I see that all the time too, but it's not accepting it as part of you and knowing more about it and wanting to know about it. It's still, yeah, it's just private. It's still very, whereas men, not so much. Men right
They
away are totally
swing it
fine
around.
with their junk. Yeah.
Yeah, literally swing it around and show
Yes.
everybody.
Yeah.
Jake,
So
we've already talked to our 8-year-old daughter about periods, tampons, etc. Not sex yet, but
yes.
hormones, mental feelings.
Good.
Amazing. Amazing.
Good. Yeah.
Joseph, being a girl dad of 2 girls, I've learned fast. Luckily, their mother did the heavy lifting with the how-tos, but I definitely had to learn the difference in feminine products. Listen,
Hmm.
my dad also would
Cool.
go to the store and buy tampons for me. So shout out to
Yeah.
all the dads out there that are doing the thing.
Yeah.
Was there any other question? Jake,
Yeah.
this is interesting. I've never met a man who didn't want to talk about biology. Maybe a culture thing. I don't know. I mean, it might be. So Jake lives in Isle of Man over in
Okay.
the is it the UK, Jake? Make sure I don't say it wrong.
Yeah.
But I wonder if that is the thing. It could
Yeah.
be a culture change, it could be a culture difference, and,
Hmm.
um, but I'm hoping that more conversations like this are able to, okay, yeah, no, okay, sorry. That more conversations like this are going to give more women permission to talk about these things and to ask questions and to, be more curious about
Yeah.
their own bodies and ways that can help.
Yeah.
Oh,
Um,
British. Thank you, Jake, for
British
that
Isles. Yeah.
clarification.
Yeah.
For that
But,
clarification.
well, yeah, and you and Christina already talked, like, you know, extensively about it, but um, why on earth are we putting a 13-year-old child on birth control when her menstrual cycle isn't even fully matured? What is that going to do when she tries to conceive? And what is that going to do for menopause? It's
Mm,
delaying everything because we have we've totally messed up the continuum, right? So we haven't
yeah.
allowed time for things to mature, and it's yeah, it's a problem. It's a big problem. Why are we just telling women to go on birth control still for as the only form of contraceptions? I just don't like that. So I'm
I
happy
think
to,
it goes
yeah,
back to your point of this idea of rushing.
yeah,
Like, it just feels like everything has to be figured out at that moment and that there is, for whatever reason, no time to just sit down and talk about it or at least provide the information. So if doctors don't wanna sit down and don't have the time to explain everything,
hmm,
why isn't there some information to go talk to somebody else or have somebody
yeah,
that is an advocate within the office that that's their job. You
yeah,
know what I mean? That is literally their job to be able to navigate and assist with questions when it comes to birth control,
yeah,
because, you know, we're just learning all of this stuff now with all these hormone change conversations and medicines and all this type of stuff, these drugs that they're trying to give to our kids.
yeah,
There are long-lasting effects to this.
yes,
Why are we not talking about the long effects that these are gonna have the same
yeah,
way when our son was first diagnosed with ADHD and then later has been diagnosed as autistic. The
hmm,
minute that he was diagnosed ADHD, they were like, "Well, he can go on medicine." I'm like, "He's 6.
yeah,
You're not putting medicine in my child. You know,
Hmm.
when he becomes older and he can vocalize and he looks at us and
Yeah.
says, "Mom, I need some help,"
Hmm.
then we can start having the conversation, but I'm not putting my 6-year-old boy on medicine. I've heard
Yeah.
stories about that. I've seen children that are medicated so badly that they cannot get off the couch.
Yeah.
And also, what are those lasting effects that, like you said, that we have from those? We don't talk
Right.
about those side effects. We just want to immediately um, give
Yeah.
this medicine and this cure.
Well,
Team
there's
of miss
because we've talked about period just with a couple of comments, whatever. But
Yeah.
if I can make a book plug, right? The Period Repair Manual by Laura Brydon is awesome for learning a little bit more about this. Whether you have a young woman at home, close to her menstrual age, what have you, or up through dealing with perimenopause and all of those kinds of things. It's just,
Mhm.
it's really educational. It's a really good book to just kind of learn a little bit more about what our options are because our doctors aren't telling us. So it lays them all out very nicely.
Mhm.
What is a preferred birth control versus our synthetic hormones and things that we're using to help with later. So yeah,
Yeah, and it also goes back to the idea that, women are the ones that have to get on birth control to not get pregnant, but we can't have the conversation about men putting a condom on.
yeah,
God forbid a man puts a condom on to do the same thing that birth control is trying to say that it's doing, and its only job is to prevent pregnancy, which obviously is not the case. You know what I
right,
mean? So,
yeah,
um oh, this is a good
yep.
one. Dr. Black, has internet pornography changed these conversations with teens?
Oh, goodness. Porn is so much more available now. Um I'll have to think of the book. It's so good, but it kind of taps into all of this. It's having yeah, yes, as far as like what's reality versus what's not, like from the ladies side, female side of things, like
Mhm,
some of that is not real. And that's not how intimacy needs to look for you specifically, but it really impacts like arousal times. We're not talking seconds for a female to become aroused. Where it's normal is 15 to 20 minutes, right? And then talking about the breastfeeding woman, the woman that's breastfeeding, like it's even more time than that, right? But and being lubricated, naturally lubricated, doesn't mean that you're aroused. So that porn kind of impacts that from the female's perspective. But this is what young men are expecting, right? And so then um, we get an actual disinterest when they're engaging with women in for the first time. A lot of erectile dysfunction issues early on, like in early 20s. It has really changed all of this. It's not great
mhm.
as far as expectations go, but from both sides. So
So
I don't
you're
know.
saying that
That's
it's not helping the conversation?
not at all. No,
Not at all, not
not
at
at
all.
all.
All right,
That's
guys.
a
Well, I'm
tough
going to keep
one.
her for a couple more minutes. So if you do have any questions that you want to ask her, this will be one of many. I hope to have you come and join us again for
Yeah,
many more conversations. But
sounds
as
good.
people are um, putting their last couple questions in the chat, if they have any, where can they find you? And are you accepting new clients at the moment?
Yeah, 100%. So I have Instagram. It's at Zia Physiotherapy. My website is ziaphysio.com. And yeah, I mean, it's even virtual consultations if you're not in the state of Virginia. Um, just to kind of talk through things if that's something you're looking for. But in the state of Virginia, yep, in-home services, virtual. telehealth options. So yeah,
Mm.
all the things.
Yeah.
But yeah,
Yeah.
lots of
Reach
good
out.
info on Instagram. Trying to be a little bit better about Instagram. I'm not the biggest fan of social media, so Casey's
I
gonna
don't
help me
blame
with
you.
that.
Oh, good. Good, good,
Yeah,
good.
yeah. So, but
Um,
yeah,
all
that's where to
right,
find me.
guys. Oh, Megan, she's right up the road from you. Go check her out.
Excellent. Let's
Go
check that
check
back
her out.
out.
Yes, I definitely will when we will talk after the show, I definitely would like to have your
Yeah,
intake form and let's chat because if we can
sounds
get this
good.
hip and back feeling
Yeah,
good,
it's been too
then
long. Yeah,
I mean, 8 years, girl.
I
Longer
know.
because I
Just
felt it while I was pregnant too, so we can get this situated and figured out. All right,
yeah,
guys. Thank you so much,
cool.
Sarah. Thank you
Yeah,
very,
no
very much.
problem.
Hang tight. I'm gonna say goodbye
Okay.
to you, privately. You guys, thank you guys so very much for being here. Joseph, thank you for becoming a new member. I appreciate you guys, and I think we have some stuff coming up closer to the weekend. But if you guys have any other questions for Sarah, put them underneath this episode in the chat and I will send them her way so that she can answer those for you guys. And again, this will be
Yeah.
one of many. Casey, again, thank you very much for contacting me and putting us together. This was amazing. All right, guys, I'll see you guys later. See ya.